Hello everyone, my name is Caitlin Stamp, and today I will be presenting my PowerPoint of adults with intellectual disabilities, or ID. This presentation focuses on their mental health needs, health disparities, and available community resources, especially here in Columbus, Ohio. Understanding these needs is important for nurses because we are often the first to identify health concerns and we connect patients with the care that they need. Research shows that adults with ID face significant mental health challenges. For example, a study in 2025 by Fraser, Hunrati, and Weinstock found that 35 to 40% of adults with ID experience psychiatric disorders such as anxiety and mood disorders. Unfortunately, many healthcare providers lack training in treating adults with ID, which can lead to underdiagnosis or mismanagement of symptoms. There is also a shortage of evidence-based interventions, especially for adults, which highlights the need for better education and support for healthcare providers. Another article by Cron and Fox in 2014 looked at health disparities in adults with ID. They emphasized that social determinants of health, life course factors, and systemic barriers significantly affect outcomes. And adults with ID often have unequal access to care, and targeted health programs, policy supports, and provider education are key strategies to help reduce these disparities. A more recent study by Submarathi and colleagues in 2024 examined the electronic health record data and found that adults with ID have higher rates of chronic conditions and receive less optimal primary care compared to the general population. Preventative care is often lacking, and integrated healthcare approaches are needed to meet their complex needs. To complement these findings, I explored community resources here in Columbus, Ohio, which I decided to focus on NetCare Access, which is a key crisis intervention agency which serves in Franklin County. NetCare provides 24/7 crisis phone, text, and chat lines, making mental health support highly accessible. Their programs include the Crisis Stabilization Unit for short-term residential care, the Miles House for additional community stabilization, and Row 1, which safely transports intoxicated individuals to care. They also provide forensic and court-related populations. NetCare's evidence-based services integration with the ADAMH board makes it a reliable resource for nurses to refer patients in a crisis. The connection between research and practice is clear. Adults with ID face complex mental health and physical health challenges. Agencies like NetCare Access provides essential crisis care that aligns with evidence-based practices. For nurses, knowing about these resources is critical because we are often the first to identify signs of psychiatric crises, suicidal ideation, or substance use emergencies. Having a reliable community partner allows us to ensure patients get timely and appropriate care outside of the hospital setting. In summary, adults with intellectual disabilities experience significant health disparities and mental health challenges. Research highlights the gaps in care, and community agencies like NetCare Access plays a vital role in addressing acute needs. By understanding both the literature and local resources, nurses can better advocate for patients and support their health and well-being. Thank you so much for listening, and these are all of my sources.